Keynote-52 was a first-line study of pembrolizumab in cisplatin-ineligible patients with advanced urothelial cancer. Overall, the study enrolled 374 patients. However, what I presented today was the interim analysis of the first 100 patients. The key objectives of this planned interim analysis was to get a sense of what the objective response rate was in the first 100 patients, but also to develop the biomarker, the PD-L1 expression score that would subsequently need to be validated in the remaining patients on study. What we found was that the objective response rate in the first 100 patients was 24%, including 6% of patients achieving a complete response. Additionally, when we looked at PD-L1 expression, and specifically what we did in this particular trial is looked at something called the combined positive score. How that is calculated is that we look at the expression of PD-L1 on tumor cells as well as infiltrating immune cells, so both of them together, and take that over the total number of tumor cells in the tumor and reflect that as a percentage. So it's possible based on that formula that the PD-L1 expression level can actually be above 100%. And using that combined positive score, what we aimed to do was find a level of expression where we enriched greatly for the responses, but also minimized the false negative rate. So in essence, what we found was that the PD-L1 expression CPS cut point of 10% or greater seemed to enrich for responses really well. What we looked at is that of the 100 patients, 30 met that criteria of 10% or greater expression, and in that 30 patient group, the objective response rate was 37%, the complete response rate was 13%, and a high proportion of patients also had stable disease. But notably, patients who had underexpression of PD-L1, including the absence of expression, there were also some responses there, including 18% of responders in that group. So what we see is enrichment. However, we do see responses in patients who have no expression or very low expression.